Hey everyone, I'm Dr. Tyler J. Tolbert from Smile Now Dental Group. If you've lost one or more teeth or you've been putting off full arch treatment, you might be wondering, is it really a big deal if I wait? Or what actually happens if I never replace my missing teeth? It's a great question and one I hear from patients all the time. So in this video, I'm going to walk you through the real consequences of not replacing missing teeth and why waiting too long can actually make things harder, more expensive, and less predictable down the line. Let's get into it. Teeth don't just sit there, they support each other. Your teeth work together as a system. When even one tooth is missing, it affects the entire structure. Over time, the surrounding teeth begin to shift and tilt towards the empty space, create bite misalignment, and develop uneven pressure points. And when multiple teeth are missing, the teeth that are left behind take on more force than they're designed for. This leads to cracks, fractures, premature wear, and more extractions. So one missing tooth can easily turn into multiple missing teeth if nothing is done. Some of the classic examples of what I see in my practice are missing back teeth, which causes the patient to only chew with their front teeth. Then the front teeth, which aren't designed to be doing all of your chewing, they crack, they chip, they either get loose or they flare out dramatically, which allows your bite to overclose and not only age your face, but also decrease your chewing ability over time. Also, some patients will still have back teeth, but because the teeth on the opposing arch are missing, those teeth erupt out of that space. They're trying to find their neighbor. So those teeth erupt, they come out of the gums, and they cause uneven and loose teeth throughout the rest of the mouth. So in other words, one or two missing teeth that go without replacement is often the first domino to fall and eventually leading to someone losing all of their teeth. Bone loss starts immediately after tooth loss. This is a big one, and it often goes unnoticed until it's too late. When you lose a tooth, the jawbone beneath it no longer gets stimulation from biting and chewing. That area of bone begins to shrink and deteriorate in a process we call resorption. Within the first year, you can lose up to 25% of the bone height in that area. And if multiple teeth are missing, that shrinkage compounds. This leads to collapsed bite, changes in your facial structure, less bone available for implants, and even increased risk of jaw fracture in severe cases. You've probably seen it. When someone has lost a lot of teeth, their face begins to look different. Or maybe you've seen someone take out their denture and all of a sudden they look 20 or 30 years older. That's because the bone in your jaw supports your cheeks, your lips, and your jawline. As that bone disappears, the lower third of the face begins to collapse inward. It appears sunken or saggy. It develops deep wrinkles or folds, and it creates what people call a collapsed or an aged look, even in younger patients. So replacing missing teeth helps preserve that bone in your natural facial shape in accordance with your youth. One of the more obvious consequences of losing your teeth are the nutritional consequences. When you're missing teeth, especially in the back where chewing power is greatest, you tend to avoid foods that are crunchy, high in fiber, and full of nutrients. This often leads to a soft, carb-heavy diet that's low in nutrition and high in inflammation. This can affect your blood sugar, your weight, your gut health, your diabetes, and your overall energy. So yes, missing teeth can impact your whole body, not just your mouth. The longer you wait, the harder it gets. And this is the part that really matters. The longer you wait on your teeth, the fewer options you're gonna have and the more expensive those options become. As bone disappears, your window for getting implants starts to narrow. Eventually, you might require bone grafting, sinus lifts, or other advanced surgeries just to make treatment possible. We also use zygomatic implants that use your cheekbones. This is something that we can do, but we'd like to avoid that wherever possible. So if you take action early, we can often use minimally invasive techniques, place implants in strong bone, and give you better, longer lasting results with fewer steps and lower cost. Here's what we tell patients all the time. The best time to replace missing teeth was yesterday. The next best time is now, before the damage spreads. You'll preserve more bone, prevent more damage, and get better long-term results. And you'll avoid the spiral of doing nothing until it becomes a full mouth reconstruction. We see patients every day who say, "I wish I had done this years ago." We want to help you avoid saying the same. If you're missing teeth, we know things are heading in that direction, so don't wait. Simply click the link in the description below to schedule your free consultation at Smile Now Dental Group. We'll take a 3D scan, assess your bone, and walk you through your options before time takes them away. Thank you for watching, and be sure to like and subscribe for more honest dental advice that puts your long-term health first. We'll see you in the next video.